What's up everybody, Dr. Courtney here, and today we are going to be talking about the little tips and tricks I tell my patients whenever they start Invisalign. So get your pencils ready, here we go. Ideally, whenever you eat a meal with Invisalign, you're gonna wanna brush your teeth. We all work, we're all busy, but ideally you're gonna wanna keep an extra toothbrush and toothpaste available in your purse, in your briefcase, tucked in your back pocket, hanging off as a keychain with your keys. Maybe not that. When you can't really find the time to brush, after you eat a meal, I suggest chewing on some sugar-free gum. I like Orbits. I don't even know what flavor this is. I like the packaging. So once you chew the gum, let that pick up the food particles so that you at least give your teeth a little bit of a clean, and just be sure to give your teeth a good brushing when you get home and you have time for it. I'm obsessed with gum. I also refuse to grow up, in case you haven't noticed. So I bought the massive size of Orbits bubblegum flavored. Tip number 2, your mouth may get a little dry during the Invisalign and your brush can get a little fresh, funky fresh, like not in a good way. So one of the things I recommend patients eat or suck on really during treatment are some sugar-free mints. Sugar-free mints that contain an extra ingredient called xylitol, which is actually a cavity-fighting sugar alcohol. You can get some xylitol at Whole Foods. I just popped into my local Walgreens and got some icebreakers. Okay, tip number 3, and this I love. Anyone who has attachments on your teeth or anyone who's wearing the Invisalign, your saliva, which naturally cleanses your mouth during the daytime, no longer happens. So I recommend you invest in some 3D whitening mouth rinse. I like this flavor, Crest 3D White. It just has a better flavor than the Listerine that I've had, but any whitening mouthwash will do. This helps lightly brighten your teeth during this process because, again, all day long you're gonna be in your trays and your saliva is not going to be naturally cleansing your teeth. Finally, discomfort. The first tray is the worst tray. So I encourage patients to take whatever they take for headaches. In my place, I have some Advil and some Tylenol. And if you had, gun to my head, if you would ask me which one do I recommend, I would say Tylenol. Tylenol is the better option because, one, it reduces the pain just like the Advil, but it keeps the inflammation there, which is the environment that teeth love to move in. So reduce the pain, keep up the inflammatory process. The reason why I'm telling you all these tips, gum, mints, whitening mouth rinse, I want to motivate you. The more you wear one tray, the better your future tray is going to fit, and the more efficiently we're going to get to that finish line. All right, guys, as I always like to say, go on and share that smile with the world.